It is 3 a.m. and we've been dispatched to a 25-year-old female who has a spontaneous nosebleed following a shower. She has no allergies, has no relevant medical history and no clotting disorders. She isn't on any other medications or anticoagulants. The patient has been instructed to hold her knees for 15 minutes while leaning forward with an ice pack on the back of her neck. This has been unsuccessful and we have advised the patient who would like to administer intranasal adrenaline to vasoconstrict the nasal blood vessel. For this procedure, I'll be using a 10ml syringe, a 3ml syringe, a drawing up needle, an MAD, 10 ml of saline and 1 milligram of adrenaline. These have also been drug checked by my offsider. So I'll start by drawing up 9 ml of saline. Attach the drawing up needle and add our 1 milligram of adrenaline into the sharps container. Into the sharps. This will give us a 1 in 10,000 solution. I'm going to pull the stopper back on the 3ml syringe to 2 ml and use the same drawing up needle to put 2 ml into the 3ml syringe. This will contain 0.2 milligrams of adrenaline and we can now attach our MAD device and administer to our patient. Hi Georgia, how are you feeling? Feeling alright?
Yeah.
Yeah, okay, can you just lift that away from your nose and just see if it's still bleeding? Okay, so it's still bleeding. I'd just like to administer some adrenaline like we talked about before. If you could just pull that away from your face and just blow into it one last time. Cool, thank you. And yeah. Okay, so when I administer this, I'd just like you to tilt your head back and give me a big sniff, alright? And we'll put this in the nostril that is bleeding. Alright, head back, 1, 2, 3, big sniff. Okay, so we'll just apply this again. If you could put that on your nose for 15 minutes and then we'll reassess and make sure it's no longer bleeding. Okay, Georgia, it's been 15 minutes. How are you feeling now?
Alright.
You feeling better? Okay, so just pull that away. Okay, so it has stopped bleeding. Because it has stopped bleeding, I feel okay for you to stay at home. Would you be okay with that?
Yeah.
Yeah. Okay, so just because we've given you this IM adrenaline today, I've just advised you to catch up with your GP within the next few hours just to make sure everything's okay. And I will document on a form that is the advice that I've given you. Are you alright with that?
Yeah.
Okay, thank you. And we've been dispatched to a 30-year-old female at 10 o'clock with back pain. On arrival, the patient is complaining of lower lumbar back pain. She's experienced back pain for a number of years. After getting off the couch last night, the pain has progressively got worse and has prevented her from mobilising comfortably. The pain is described as achy but is not consistent with her normal muscular pain. The pain is localised to the central lumbar spine and is not radiating. Her pain is 6 out of 10, but her usual pain is only a 3 out of 10. She has no allergies or relevant medical history. She takes paracetamol and ibuprofen for her normal management. She has been eating and drinking normally and has no loss of bladder or bowel function. She has no present weight loss or IV drug abuse. Patient is systemically well and vitals are all within normal range. I have gained consent to perform a full examination of her lower lumbar back. Hi Georgia, how are you feeling today?
A bit sore.
A bit sore? Where are you sore?
Just my back.
Your back? Okay. Right, if I can get you just to roll onto your side, facing away from me, and I'll just if I can lift up your top, is that alright? Yeah. Okay. I'll just have a wee feel. That's all when I do that?
Yeah.
Down here?
Yeah.
Yeah, okay, I'll just have a feel at the sides too. Sore?
Yeah.
Yeah, okay. Just along the back here?
Yeah.
Yeah, okay, alrighty. I'll just get you to roll back onto your back and I'll have a palpate of your tummy. Have you had any pain there?
No.
No? Okay. Not sore?
No.
No? Haven't had any loss of sensation or pain in your legs either?
No.
No? Okay. Let's have a feel. You could just push against my hands. Yep, and then pull down. Sorry, yep, and wiggle your toes. Yep, they're all fine? Yep, okay. Right, we'll just get you to, have you been able to mobilise today? Like, walk around or anything, not sore?
Yeah.
Yeah? Okay, right. We'll just get you to show me. If you can hop up. And we'll just get you to, you're right standing?
Yeah.
You can just walk. Okay, so let me know if you need a hand and we'll just go for a little walk. Yep, and back again. Yeah, and that's alright?
Yeah.
Okay, so we'll get you up on the stretcher now. So I understand you take paracetamol and ibuprofen for your normal pain relief, is that correct?
Yeah.
Okay, so have you had anything in the last 4 hours?
No.
No? Okay. Alright, so what we can give you is your normal pain relief as well as some tramadol, which will be a little bit stronger and should hopefully just dull that pain a bit more. So what do you weigh?
60 kg.
Okay, so if you put out your hand and I'll give you one tablet of that, and then we'll see how that goes in terms of your pain relief, alright?
Okay.
So based on your weight, I can also give you 2 paracetamol and 1 ibuprofen, just to hopefully kick in and dull that pain again. 15 to 30 minutes to kick in. Just so we can make a plan of what we're going to do today, we're just going to go through some red flags checklist just to make sure that you don't have any of those things.
Yep.
So you haven't had any loss of bladder or bowel control?
No.
No temperature greater than 38 degrees?
No.
No rigors, no abnormal vital signs, no pain in the thoracic spine or chest, abdominal pain or tenderness? No. Altered sensation in the saddle area, so around here?
No.
No. Altered sensation and or power in both your legs?
No.
No. And you haven't been unable to walk?
No.
Signs and symptoms of generalised illness, so no cough, cold, flu?
No.
No. And the pain is not radiating down both legs?
No.
No. So with that red flags checklist, we have been able to rule out any serious illness or chronic condition. So I feel happy for you to stay at home today. Are you okay with that?
Yeah.
Okay, so I do advise that if you do start to feel worse, that you call us back or call in and see your GP within a few hours.
Yep.